friends, I'm Dr. Sandeep Guthe. I'm a practicing physician in Navi Mumbai. I want to send this message on the hypertension. Need to have awareness regarding hypertension, regarding the problems which we face due to hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, out of which 27% are attributed to cardiovascular deaths, and which affects 45% of people in the 40 to 69 age group. So if you see this problem, then blood pressure is among the most important factors for the cardiovascular deaths. So moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care, and through primary care and poor follow-up. So if them can be tackled, I think we can decrease the load of cardiovascular deaths and mortality in Indian population. The prevalence in India has gone up over 30 years from 38% 38% in men and 32% in women, from 29% to 28% respectively. Means it has increased almost 8 to 10% over last 2 to 3 decades. So if you see, International Society of Hypertension has released an ISH 2020 global hypertension guidelines, in which the inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource poor settings or optimal care refers to evidence-based standards of care, and whereas essential standards refer to minimum standards of care to allow a specification of essential standards of care for low resource setting. So basically, ISH has says with whatever global load of hypertension, there should be attempt to address this load and try to have the evidence-based standard care where we can reduce the cardiovascular mortality and morbidity by controlling the hypertension. Even AHA and ACC has released the scientific statement offering new guidelines for the management of stage 1 hypertension among patients with low CVD risk. So previously it was considered we can have there is no need to go aggressive in a stage 1 hypertension if there is a low CVD risk. But the current guidelines says if the BP is not controlled over 3 to 6 months, even a stage 1 hypertension, we should think about starting a pharmacological therapy. And currently we know COVID-19 has affected world over, and the ARDS which is there because of which there is a lot of morbidity and mortality in the COVID-19. The metoprolol, which is antihypertensive, is found to have reduced lung inflammation, and it improves the respiratory function in people with COVID-19 induced ARDS. So again, this is an additional benefit with the antihypertensive drug metoprolol, where we can reduce the morbidity and mortality due to COVID-19 ARDS. So lowering the systolic blood pressure targets down to 110 to less than 130 millimeters of mercury range is found to reduce the severe risk in the STEP randomized trial. So initially we had a sprint trial, and this STEP trial, which is a randomized trial, it has confirmed the findings of sprint trial, where the Chinese population among the 8,500 patients between 60 to 80 years, they were given intensive target trimmer therapy to reduce the severe risk, to reduce the hypertension, and they have found there is significant decrease in the cardiovascular morbidity and mortality if the targeted BP controlled approach is given. So with regard to the prognostic value of the ambulatory blood pressure monitoring and nighttime blood pressure, in 2018, European guidelines have suggested the management of arterial hypertension. We should not only rely on the office BP measurement, but we should think about the out of the office BP measurement like ABPM and HBPM, that is home blood pressure monitoring. And 24-hour and nighttime BP measurements are associated with greater risk of mortality, that everybody knows. And we should target to achieve the nighttime BP control, and early morning dipping is important. So we should not only rely on the office BP, we should think about the 24-hour ABPM to find out the high risk population which can lead to cardiovascular morbidity and mortality. And I conclude that if we try to achieve the goal of hypertension, and if you try to give the message to the general population regarding the need to control the hypertension, many times diabetes is considered more lethal than hypertension, and people usually check their sugars every 3 monthly or 2 monthly, and with the reports, printed reports, they get more this thing target to achieve the control. But BP control or hypertension control is not given that much priority, and I think this should not be the case, where we found this BP control or hypertension control to the optimum level can help in the decreasing the cardiovascular risk and morbidity and mortality. Thank you very much.